the definition we're working with of chronic pain is any pain that's felt 15 days out of 30 for 3 months or more is chronic. Physical, mental, emotional, spiritual, doesn't matter. It all sends the same signal to the brain. It hurts. So the brain can't tell the difference between one kind of pain and another. A broken bone, a broken heart, it's all the same signal.
Hello, Elizabeth. How are you?
I'm great, Jawaria. It's great to see you. Thank you so much for asking me to be a guest on your podcast.
Yeah, thank you, especially on a Sunday. Thank you for your time. Can you tell us a little bit about your background and experience in coaching patients with chronic pain and ancestral clearing?
Sure. I have a history of suffering with chronic pain. I suffered for 40 years, and the physical, I didn't realize there was so much emotional there. The physical was really kind of in the front burner, but there was a lot of emotional under there as well. It took me that long to find a doctor who actually understood the nature of chronic pain. All the other doctors prior to that had said that that would be my lot for the rest of my life, and I'd have to learn how to live with it, which I didn't believe, but they didn't have anything. They didn't have anything other than opiates and benzodiazepines as an answer for helping me cope, which just compounded the problem. But they didn't know that. That's the best that they could do.
Yeah.
So I finally found a doctor, Dr. Peter Prescott. He wrote a book. He passed away in 2016, but he wrote this book, Conquer Chronic Pain, an Innovative Mind-Body Approach. And he understood the nature of chronic pain. And he also understood how to get patients off of that medication. It was a very popular combination for a while. And he got detoxed thousands of patients off of that. I was one of them. I went into his program, and he really guided me through. He called himself a doctor, but he really helped us focus on our own ability to heal, and he really would have considered that he was a guide, and that we had the power. He kind of was like, I remember the first thing he said to us was in his class was, what are you doing to contribute to your pain? And I was like, in that moment, my attitude was, I'm not doing anything. It's doing it to me.
Yeah.
But just by the very nature of his question, he took me from victimhood into empowerment, because he opened the possibility that maybe I had a role in my own pain, therefore in my own healing. Very powerful. So anyway, that was a very powerful experience. Within that program, he had a wellness practitioner, John Newton of healthbeyondbelief.com, who did ancestral clearing. And that was a modality that Dr. Prescott worked with, among others. We did adversity therapy, and we did Qigong, and we did, we did a lot of other things, breath work and other things, but ancestral clearing was a big piece of it. And I remember being a child, maybe 4 years old, and realizing that there was trouble in my family. There was a shadow, there was a weight, there was darkness in the family, and nobody talked about it. And I wasn't allowed to speak up, so I didn't say anything about it. But it didn't mean it wasn't real. And it wasn't until I got into ancestral clearing work that I was able to address it, because I carried it too. I mean, my family carried it, I carried it, we all carried it, that I was able to release that. So that was kind of interesting. So I got healed in 2013, and I started my business in 2014, and I working with people in recovery from addiction, any kind of addiction, people that are trying to clear chronic pain, people that are in recovery from chronic pain, that's a whole thing. And then I do ancestral clearing for anybody. So I've got kind of a mixed.
So you use quite a few modalities to help clients.
Oh,
Could you,
yes.
I'm sorry.
Yes. Yes, I do, including yoga and meditation. I teach, have a deep dive into yoga, but I really focus on the trauma informed part with my population. Yeah.
Great. So could you provide an overview of your coaching process and how you integrate ancestral clearing into it? Like when does it come into the picture?
Sure. Yeah. The first thing that I do with a client, whether it's a new one or one that I've seen before, the first thing I do is assess the state of their nervous system. Are they dysregulated? Are they, nervous? Are they calm? What's happening there? Because really, in order for me to really do anything with someone, they have to feel safe. And in order to feel safe, the nervous system's got to feel, regulated. We have to be able to connect. And then we can learn that hierarchy to healing, regulation, connect, learn. So the first thing I do is what kind of, how are they doing with their nervous system? And often I'll start with a 3-minute breath practice, which is very interesting because if they're dysregulated or feeling tentative and they're willing to just do this little simple breath practice in 3 minutes, they've shifted their experience. The body's different. And you can see them calm down and they have a sense of safety. And some of them have they've been so revved up for so long, they have forgotten what that feels like. Right.
Yeah.
So you see this look on their face of relief and almost joy that their body remembers how to do that. Right. So anyway, so I start there. And then I listen to their story for about 5 minutes. With my history, there are very few people in the chronic that are suffering from chronic pain that have sat in front of someone else who really knows the territory experientially. And so speaking in front of, telling your story in front of, instead of me, who really understands the space, versus Dr. Peter, who wasn't a chronic pain patient, but he understood it neurologically. Like he understood psychologically and neurologically, but he didn't understand the lived experience of it.
You've been there, yes.
Yeah, so it was fun. If it had lived, I would have been part of his team as a mentor.
Yeah.
Because having a doctor who understands the neurology and the psychology, that piece, and then have somebody who understands the lived experience, that's an interesting team. Right. Anyway, so I'm a great coach for doctors in this space that have patients that are trying to find their way through an integrated pain management program. I'm a great coach in that space.
Yeah.
So second thing I do is listen to their story for about 5 minutes. I don't give them any more than that because oftentimes in this space, in the chronic pain space, patients they identify with their story. They don't realize their story is an experience they're having, but it's not who they are. So I'm careful within that. I want them to be heard, but I don't want them to be attached to their story too much. Then the next thing I do is I bring in ancestral clearing. I like to work on the stuff in the lineage first, and help them, if they're willing, and to help them release the effects of intergenerational trauma, if that's what we can get to. It kind of depends on the ancestral clearing process is done in the moment. So it's kind of what comes up for the client in the space in the moment that's what we can work with, if that makes sense. Yeah.
Yeah. So what are, in your experience, some of the challenges that chronic pain, that are unique to chronic pain patients, and how do you help address them during coaching?
The mind, the mind, the habits of the mind in a chronic pain patient, and that they're a little different than a regular non-chronic pain person. And just for the audience, just really quickly, the definition we're working with of chronic pain is any pain that's felt 15 days out of 30 for 3 months or more is chronic. Physical, mental, emotional, spiritual, doesn't matter. It all sends the same signal to the brain. It hurts. So the brain can't tell the difference between one kind of pain and another. A broken bone, a broken heart, it's all the same signal. So that the chronic pain is changes the way the brain perceives things. You know, the brain is very adaptive to current circumstances. It's always changing, and because chronic pain it's like this reoccurring theme, the brain adapts to that, and what happens there is the emotional center gets affected, and the focusing, our ability to focus gets affected. So how that plays out is we get a pronounced negative mind. We already have a tendency to negativity anyway. It's to keep us safe in the world, but in chronic pain, it's next level and then some. So everything's wrong with the world, everything's wrong with me. It's just this negative issue. So, and it's a habit, and the brain gets used to that groove. And the more it does it, the more hardwired that is, the more used to it's going to hang out in that space. So that's partially the mind that's doing that. It's actually a kind of a physiological state as well, because there's biochemistry that's feeding that. But that's the journey. So and also I don't work with people that are on opiates or benzo. Well, I have some people that I do. That's not actually true. I work with some people as a coach as they're coming off, but mostly in recovery. I have mostly people that are have benzodiazepine in their system. I work with those because if they're doing a taper, they have all kinds of anxiety problems, and I know that space really well because I lived it. And so I'm a great coach in that space. That anxiety, a lot of that has to do with, yes, it's physiological, and they don't have a breathing, conscious breathing practice. And that is very helpful in that space. So, so the negative mind, the habits, the biochemical soup that creates that as part of it. Also, I'm not a nutritionist, but I do point them in the direction of working with a doctor, a nutritionist, some naturopath, functional doctor, something to help them with their diet, to make sure that it's clean and anti-inflammatory, sugars out of it, that there's plenty of water on board, that kind of thing. And I bring in what's the other thing? So there's the negative mind, the chaos in the brain. It's just, I can't remember what I just did. Difficulty focusing. So we bring in meditation as a huge antidote to that.
So mindfulness and meditation seem to have a lot of role in.
Yeah, and it's tricky because the nervous system of a chronic pain patient is hypervigilant, which means it's just tense and I know this, I lived it. It's just tense all the time. And so putting them in a meditation practice is which is why I do the trauma informed, because if you ask them to sit still, that can be traumatic for them.
Yeah.
So we have to, so I bring in chanting and a little bit of movement, breath work. I make sure that they're moving somewhat so that the body's not doing this. So they have energy has somewhere to go. Yeah.
So that's one of the places where being trauma informed helps.
Oh yes, that was a huge piece of it. Now, I as a yogi, I understood. I have a big yoga practice, and I have a lot of training in that. But polyvagal theory and really understanding the science part of the neuroscience, which the yogis, I think they don't have all the words for it, but they understood the things to do to affect the system. It's just that we now have we have, different words, and we have a kind of like an understanding of the physiology and stuff, which is handy because depending on who I'm coaching, they want that information. Some people don't care, but some people want that information. Why are you teaching me this? I need to know why. Right? That's part of the mind again. Right?
Mm-hmm. Yeah.
Yeah. Also,
What-
there's a very part of the hopelessness, or sorry, part of the negativity is this uh, kind of a real sense of hopelessness, that they're not going to get better, or if they do something new, it's going to get, their pain's going to get worse. So that's a very interesting space to.
There's fear involved, fear of
Oh,
feeling the pain. Yeah.
yeah.
So many emotions are involved. So I'm sure people come to you after they have tried many modalities unsuccessfully.
They do.
What resources or tools do you recommend for self-help or continued growth after completing your coaching program?
Oh, well, part of my coaching program is to give them a daily practice,
Mhm,
is to help create a daily practice for them,
mhm,
which includes, again, working with the nervous system, making sure that they're working on keeping that regulated, widening that window of tolerance, building their
mhm,
capacity to be resilient. It's
mhm,
not to say that they're not going to get activated in the world, but
mhm.
when they do, it's not going to be as, they're not going to be as reactive. It's not going to last as long, and they're going to, and they're going to have, there's going to be more space between episodes.
Mhm.
Right. This is what we, so those things, but you have to have this daily practice to keep reminding the nervous system and the mind to, this is how this is how we're doing life now. Remember, it's a habit. It creates a habit. So you have to rewire the work that we do in this space is we're rewiring the brain
Rewiring the
to,
brain.
to act in a new way. Not that it won't go into the old way, it'll slip
You'll
in
be able to
eventually,
recognize it.
but yes, you recognize and go, oh, I'm in that old thing and I'm going to do it this way. Right. So
Mhm.
it's this, uh, that would be another thing that we see in chronic pain that goes along with hopelessness and fear is impatience
Mhm.
and inflexibility. See, all these things are,
Mhm.
all this is also a nervous system that's hypervigilant.
Inflexibility is a big one, isn't it?
Yeah. Oh, yes. Yeah. And this is why we do the work we do, because that
Right.
creates more flexibility, more
Mhm,
adaptability, more resilience in the system. The trick, really, in this space as a coach,
mhm.
um, is to give the client an experience that they, in the moment with me, that they can then take as a tool and use themselves so that they feel empowered over this thing that's happened
Yes.
to them. Yeah.
Hey, is there anything I missed that you want to touch on?
Yeah, I think there is one piece. If I had to do a TED, if I had to do a TED talk,
Huh?
the question I would ask myself is, what do I want people to know what I want them to remember when they leave the room?
Mhm.
And the mantra I want them to say is, you are your greatest healer. It lives within you. Like, we look to the medical community and all the healers and helpers and coaches and all those people,
Mhm.
and they give us the best instruction that they have to support the body, mind, and spirit as it's healing.
Mhm.
But the intelligence in the body is doing the healing, not the doctor or the coach or the nurse or whatever. It's the intelligence in the body. So,
Yeah.
and we get confused about where who's doing the healing. And I feel like that disempowers us when we're leaning on the doctors or the physical therapist or the coach or whoever it is, when we're leaning on them and like grasping for, you know, they're there as guides and they're wonderful, like, right? We're
Mhm.
all we're all doing the best we can, but the intelligence is in the body. And I just feel like that's a very balancing, helpful perspective.
And how do people contact you, Elizabeth?
Oh, yes, they can find me at my website. I'm at Elizabeth with a dash kipp.com, Kipp, like Peter Pan. You got to put the dash in there because ElizabethKipp.com is a web designer and a photographer.
Okay, so you know that.
She's amazing, but she's not me. Yes. So Elizabeth-Kipp.com. You can email me through there. You can contact me through there. You can find me on social media. There's lots of free resources on the website, lots of blogs and interviews and all kinds of things you can get a hold of. Yep.
Yeah, thank you so much for your time.
Well, thank you so much, Jawaria. This was delightful and all the best to you.
Thank you.